Do you believe depression is merely a sign of weakness or something you can just snap out of? If so, you're not alone. There are many misconceptions about depression that persist in our society, often leading to stigmatization and lack of proper treatment. One common misconception is that depression is a sign of personal weakness, that it's a character flaw or a deficit in one's personality. This couldn't be further from the truth. Depression is a serious mood disorder, a medical condition that impacts a person's daily life, their thoughts, feelings, and their ability to function. It's not a sign of weakness, any more than diabetes or heart disease are signs of weakness. Another widely held misconception is that depression is something one can simply snap out of, that it's just a matter of pulling oneself together. This is not the case. Depression is not a choice, nor is it a condition that can be overcome simply by willpower or a positive attitude. It's a complex condition that often requires long-term treatment, including medication and psychotherapy. Some people believe that depression is just a bout of the blues, that it's a normal part of life that everyone experiences. While it's true that everyone feels sad or low at times, depression is much more than that. It's a persistent feeling of sadness and loss of interest that lasts for at least 2 weeks and often much longer. It's not just a fleeting mood or a temporary response to life's challenges. Lastly, there's a common misconception that if you're depressed, you should be able to tell. But depression doesn't always look like the stereotypical image of someone unable to get out of bed or constantly crying. Many people with depression are able to go about their daily activities, masking their pain behind a smile. But inside, they may be struggling with feelings of hopelessness, worthlessness, or thoughts of death. Depression is a complex condition that requires understanding and proper treatment. It's time we challenge these misconceptions and foster a more compassionate and informed perspective on depression. Depression can manifest in various ways, affecting both the mind and body. Depression is more than just a persistent feeling of sadness. It's an invasive, all-consuming mood disorder that can lead to a myriad of emotional and physical problems. It's not just a bout of the blues that you can snap out of. It's an ongoing battle that may require long-term treatment. Imagine waking up to feelings of sadness, emptiness, or even hopelessness that linger throughout the day, nearly every day. These feelings are not fleeting, they're persistent, and they're often accompanied by angry outbursts, irritability, or frustration, even over trivial matters. This is the emotional toll of depression. But depression doesn't stop at emotions. It extends to our interests, our sleep, our energy levels, and even our appetites. A person battling depression may lose interest in activities they once enjoyed, from hobbies to sports. They may struggle with sleep disturbances, such as insomnia or excessive sleeping. They may feel perpetually tired, with even small tasks requiring extra effort. Their appetite may fluctuate, leading to weight loss or gain. Depression can also lead to anxiety, agitation, or restlessness. It may slow down our thinking, speaking, and body movements. It can make us feel worthless or guilty, causing us to fixate on past failures or blame ourselves unnecessarily. It may impair our ability to think, concentrate, make decisions, and remember things. Depression is severe enough that it can even trigger recurrent thoughts of death, suicidal thoughts, suicide attempts, or actual suicide. It's a serious disorder, one that can also cause unexplained physical problems, such as back pain or headaches. For many people battling depression, these symptoms are severe enough to cause noticeable problems in their day-to-day activities. Work, school, social activities, or relationships with others may suffer. They may feel generally miserable or unhappy without really knowing why. Recognizing these symptoms is the first step towards seeking help and treatment. Depression is not a sign of weakness, but a sign that you need to reach out for help. And there are plenty of treatments available to help manage these symptoms and improve your quality of life. Depression does not discriminate. It affects people of all ages, from children to the elderly. A common misconception is that depression only affects adults, but that's far from the truth. In children, depression may not look like the typical sadness or hopelessness we associate with the condition. Instead, it might show up as irritability, clinginess, or worry. Little ones may complain of aches and pains, refuse to go to school, or be underweight. These signs can often be overlooked as just childhood phases or mislabeled as behavioral issues. As children grow into their teenage years, the symptoms of depression can become more complex. Teens may exhibit feelings of negativity and worthlessness and display anger or frustration. Poor performance at school, a sudden disinterest in activities they once loved, or avoidance of social interaction can all be indicators of depression. Some may turn to recreational drugs or alcohol, or even engage in self-harm. When we move to the other end of the age spectrum, depression in older adults is often mistaken for a natural part of aging, which is not the case. Symptoms in older adults may be less obvious or different. They may experience memory difficulties or personality changes, physical aches or pain that can't be attributed to other medical conditions. Fatigue, loss of appetite, sleep problems, or loss of interest in sex could all be signs of depression. A tendency to stay at home, avoiding social activities or new experiences can also be indicative of the condition. Recognizing these differences in how depression presents across ages is crucial. It allows for early diagnosis and more effective treatment. It's important to remember that depression isn't a one-size-fits-all condition. How it manifests can vary greatly depending on an individual's age and life circumstances. Depression is not a normal part of growing older, nor is it a phase that teenagers simply grow out of. Understanding this is the first step towards breaking the stigma surrounding mental health and towards a world where everyone receives the help they need. Feeling depressed? You are not alone, and help is available. Depression is a heavy burden to bear, but it's crucial to remember that you don't have to bear it alone. Reaching out for help when you're feeling depressed isn't a sign of weakness, but a courageous step towards recovery. Depression is a medical condition, just like diabetes or heart disease, and it requires professional help. There are several treatment options available for depression, and the most effective strategy often involves a combination of these. Firstly, there's medication. Antidepressants work by balancing chemicals in your brain called neurotransmitters that affect mood and emotions. These medications are not a quick fix, but they can help reduce the symptoms of depression over time. Then there's psychotherapy, also known as talk therapy. This involves speaking with a mental health professional to learn how to manage depression. Cognitive behavioral therapy, interpersonal therapy, and problem-solving therapy are among the most effective therapeutic approaches for depression. Psychotherapy can help you understand your illness, alleviate your symptoms, and equip you with the skills to prevent depression from returning. It can help you change negative thinking patterns and improve your coping strategies so you can navigate life's challenges in healthier ways. Don't forget, you don't have to navigate this journey alone. Reach out to healthcare professionals who can guide you through the process of recovery. It's also important to talk to trusted friends, loved ones, or faith leaders about what you're going through. Their support and understanding can provide immense comfort and strength. If you're feeling apprehensive about seeking treatment, remember that it's okay to take small steps. Start by reaching out to someone you trust, and they can help you take the next steps towards seeking professional help. And remember, treatment takes time. It's important to have patience with yourself and the process. It's not about snapping out of it, but about taking gradual steps towards feeling better. Remember, seeking help is not a sign of weakness, but a step towards recovery. Depression can sometimes lead to life-threatening situations. It's crucial to know when and how to get emergency help. Let's delve into this further. When depression intensifies, it can lead to recurrent thoughts of death, suicide attempts, or unexplained physical problems. These are all indications that immediate help is necessary. Bear in mind that these are not signs of weakness or a cry for attention. They are serious symptoms of a severe mental health condition that requires urgent attention. Imagine this. You're in a room filled with darkness, and you're trying to navigate your way through, but it's overwhelming. It's like being trapped in a maze with no exit in sight. This is how many people who contemplate suicide describe their feelings. If you or anyone you know is experiencing this, it's essential to reach out to a mental health professional immediately. Don't hesitate. Don't second guess, just reach out. Next, let's talk about unexplained physical problems. Depression doesn't just affect the mind, it can also manifest physically. This could include headaches, back pain, or other physical discomforts that don't seem to have an apparent cause. If these symptoms persist and are accompanied by feelings of despair, it's a clear signal that professional help is needed. It's also crucial to remember that depression can sometimes hide behind a mask. It can appear as irritability, frustration, or even anger. So if someone is lashing out or seems excessively angry, it might be a sign of something deeper. It's vital to approach the situation with empathy and encourage them to seek help. In all these situations, it's important to act immediately. Reach out to a mental health professional, call a helpline, or take the person to the emergency room. Each second counts, and swift action can make a world of difference. Depression is a formidable adversary, but it's not invincible. With timely intervention, understanding, and the right treatment, it can be managed and overcome. Remember, every life is valuable, every person matters. You matter. Your life matters. Depression is a serious condition, but with timely intervention, it can be managed and overcome. Your life matters.